With that, we will open it up for questions.
Director McCarthy,
what are your
you painted an optimistic picture for the future for vaccinations. The reality for the president is you sent tens of thousands of people on a fool's errand this past couple of weeks, this past week specifically, because you opened it up for 160,000 people with 1,800 doses. You had 2.5 million views on your page, and that engenders frustration. So can you give me the thought process? It's nice to say, hey, we're going to get it done by April 19th because we got all this coming in. Why in the world would you open up that tranche of people when you knew you only had X number, a very small percentage of first dose? What's the mindset?
Yeah, I think the big thing for us is to continue to sustain, that nation-leading rate of administration. At that point, we'd vaccinated and scheduled above 80% of everyone that had already been eligible in Rhode Island, and we had doses that were ready to go into arms. And fully recognize that it's frustrating, when demand far outpaces supply. But we have 5,000 first doses to get into arms this week in state sites.
Why did you wait a week when you got more in? It's still, the numbers don't add up.
Because each day is critical. Waiting 1 week, that has a significant public health impact. So for us, it's getting a shot into an arm as quickly as we can. But with that, we're committed to continuing to improve the experience. And we'll have some more info on that in the coming weeks. So we acknowledge that we're committed to continuing to make that a better overall scheduling experience. But the best thing from a public health perspective and for the state of Rhode Island is to get shots into arms as quick as we possibly can.
Go over the numbers of, so 160,000 people come on board. When you open up that next group, or whatever that group is, so what are those numbers? When you get to April, so how many people are available now? How many people have been vaccinated? When that next tranche opens up, is it another 50,000? It is another 200,000? What are the numbers that we're looking at?
Yeah, we're working on the detail that gets us from now to April 19th, learning on the experiences to date, and then continuing to roll out technology supports that are going to help make that scheduling experience better. So we'll have more details on that next week.
About the homebound people, I have a woman who has 94-year-old parents who contacted me. She said 3 weeks ago she contacted the health department. She got a SurveyMonkey survey, has heard nothing. So for her right now, you mentioned 3 companies. What does she and others who have homebound relatives, who can they contact today?
Yeah, we have information on our website, the 80. Okay.
What can she? Who can she call? What's the contact right now?
Jim, I'll get you.
Yep.
Governor, this isn't going to happen with the next group, and how much of this is political pressure just to open up? Connecticut and Massachusetts announced the accelerated eligibility by mid-April as well. How much of this is political pressure, even though you acknowledge the appointments may not be there to actually do it?
I don't think it's political pressure. We're saying to people we need to make sure they get vaccinated. We know that there's more demand than there is supply. We've just mentioned that we're going to be able to do as much as 160,000 shots in a week. We're going to keep the pressure on D.C. to get us the supply, and we're going to build it out. Now, as far as that Friday, that was a 2-hour, 3-hour type time frame. And I've talked to people who were frustrated that actually got appointments. So we're encouraging people to continue to try to get appointments. We understand that there's not enough supply to cover the demand, but we got to make sure that we get every shot in the arm that we possibly can.
Governor McKee, what are your administration's public health benchmarks that, when met, will result in the suspension of the state emergency order, restore civil liberties, and end the arbitrary and capricious shutdowns that have destroyed the private economy here in Rhode Island?
Yeah, so I mentioned that last week. I think that we don't have a firm vaccination number, but it's in that range of 70%, one shot.
Respectfully, Governor, that's not the question. The question is, what are the benchmarks? It doesn't require...
I just told you, 70% of the shots in the arms of the people in Rhode Island. I'm looking forward to, eliminating this executive order in terms of the emergency order, and to get, working with the General Assembly in a way that we traditionally have. So.
70%, if you were going to need 70%, I'd like to finish, please. what you were saying, for the record, is that when we receive and attain a 70% vaccination rate, then you will end the civil order that has shut down Rhode Island.
Well, first of all, there was a reason to have the emergency status that we've had. People are getting infected there. We have families that are dying. God bless them all. So the notion that somehow that what we did was an overreach is not, I don't accept that. Yeah.
Okay, final, please. One more question. Just, if in fact you're talking about full vaccination by April or May, then why is Stephen Pryor discussing limiting the opening of the true economy to July, August? September, whenever.
The idea is that we're going to have one shot and everybody's on by the end of May, just like the President said. I got confidence that those supplies are coming. We're opening up the planning stages because I don't know if you've ever done an event. I have. It takes several weeks to do that, several months to do that. We're opening it now so that we're up and ready to go when the time comes that we can open up for the summer. So I think we're looking at that, and we're opening up the process in a way that is advancing, thinking months down the line to make sure that these things happen.
I'm sure people could plan right now.
So no, Alexa and Steve.
Can I?
Dr. Alexander Scott, Director McCarthy, this question is both for you. I would like to address the homebound issue. Not every homebound senior has access to a computer. They're not all served by a home health agency. How are we making sure that we're not leaving anybody behind?
Yeah, it's an important focus that we have. The link that had been shared previously was so we could have the list of everyone who is homebound and be ready to reach out to them. We have also shared that you could call our information line, understanding that not everyone has access to the internet, 222-8022. Call us, let us know that you or a family member or a loved one or a friend you know is homebound, and we have now finalized the process to have the companies that are preparing to go out and deliver those. We've said over the last few weeks that it should be happening within this coming week, and that's what our intention is to do.
And then just a follow-up to that as well, the health department, you guys are developing a waiting room to schedule a vaccine. When is that coming out? What's it going to look like? And why did it take so long to come out?
We'll be providing some more details on that. We want to make sure that it is solid and in place and ready in advance of us opening eligibility further. And, you know, to the points mentioned earlier, as soon as we have any vaccine available, no matter how small the amount, our focus is to get it into the arms of individuals who are out there. So once we were starting to run short on finding those individuals in the previous eligibility group, we wanted to make sure that we opened. When we had more vaccine, it would only be a couple thousand additional to still cover 150,000 people. So there's never any perfect time to do that where it's not going to be frustrating. I did say last week, please be patient with us. As we continue to get more vaccine, we will get it into more arms, and we will have that additional registration support service to improve the user experience, which is the goal as well.
So will they be, I have a follow-up to that. Will they be notified when a dose is available to them once they enter into this waiting room? How will it eliminate the frustration?
We'll be back with some more of those details. I'll welcome Tom to add anything. But our plan is to have that all mapped out and clearly shared well in advance of that being available.
Governor, I noticed that your proposed budget fully funds the Ride-Out multi-hub bus plan that will clear out most of the buses in Kennedy Plaza despite the opposition of the Providence City Council, neighborhood groups, racial justice, and public transportation advocates. In fact, the only group I can find in favor of the plan besides DOT are rich downtown building owners who want to clear out the homeless and working class people of color from Kennedy Plaza. The plan has been called racist. It's the subject of a Title VI lawsuit, seems to misappropriate funds from a 2014 bond referendum, and was done with virtually no public input over the objections of riders. So I'm wondering, why are you supporting this plan?
$35 million is on the line to help improve transportation in Providence, and we're going to use it, and I'm sure that the final plans will speak to the issues that you just talked about.
Ride-Out has refused to actually have any kind of public interaction with the riders or anybody else who's been raising these objections for a long period of time, actually, going on 2 years.
Happy to follow up on that. We, keep this to the COVID, and I can tell you that
people who are affected by this plan are in fact the people who are most affected by COVID in Rhode Island.
I answer again. This $35 million has been appropriated to help transportation in the city of Providence, and the smart thing to do is find a good way to use it, and that's the intention, and that's why it was in the budget.
But the $35 million isn't really being done to improve community life, it's being done to dismantle it, and it's not being done to, I mean, $35 million can be spent either way. It can be spent for good or bad reasons. No one's objecting to the spending of money on public transportation. They're objecting to the way it's being spent, to the adverse effect of Kennedy Plaza to the bus riders.
I'm just going to answer it the same way. $35 million invested in Providence right now is a good investment, especially coming out of the pandemic when we lost 70% of the income to the businesses in downtown. So.
There's hundreds of people, maybe thousands of people a day who will be affected by this, adding 20 minutes, maybe an hour to their commute.
I'm confident that it'll be a good plan, and we're going to invest those dollars to improve the transportation in Providence.
You mentioned you're looking forward to the date and the emergency authority here in the state. When do you have a date on that? Do you have a date that you're looking at? And who calls that to an end? Is that you, or would that be the General Assembly?
Well, I'm going to be working with the General Assembly. I think it is the governor's charge right now on those executive orders, and we are looking forward to that time frame when that there's not an executive order or an emergency in place. So, but it's going to be subject to the vaccination rate and the people who are so we get into a spot where we know that people are not at risk. As soon as they're not at risk, we're going to remove the emergency order, and we're going to work with the General Assembly in conjunction with that.
What's that vaccine rate look like?
I think it's going to be in that range of 70%, one shot, at least one shot to 70% of the people. And again, the President has said we're going to have the volume to get that done by the end of May. And you just heard from Tom that we're gearing up on the, and I want to emphasize this to the people who are watching right now. We are building capacity in a way, and Dr. Alexander Scott said that, we've gone from 50th or whatever it was to top 5. We're going to make sure that we're maintaining that level of vaccination so that we can get to that point as quickly as the vaccines are made available out of Washington.
So 70% top 5, what do you have the numbers on how close we are to that 70% threshold, Doctor?
We're modeling out that, and I've asked that to be made in terms with Tom, and we'll have that answer for you next week. But we want to see where we do want to answer that kind of not an absolute date, but we do want to have a range, and we want to back off of that date so that we actually keep in pace with that date, because that's the goal, right? The goal is to do exactly what has been asked in a couple of questions here, is to get off the emergency situation and getting back into where we're opening our schools and we're reopening our businesses in a way that makes sense, and finally, making sure that we're being fair with everybody out there, as Dr. Alexander Scott said, in terms of how people have been impacted by this crisis.
And then Paul.
Mr. McCarthy, I have two questions. First, the mass vaccination sites. We heard from the Woonsocket mayor that may not be opened at the end of the month, like the state is saying. Second, so what are the plans there? And secondly, where exactly in South County? People want to know where it's going to be because they don't want to make the drive all the way to Cranston. So where is that going to be as well?
Sure. So for the Woonsocket site, the site itself will be ready by the end of next week. And the only thing that we're waiting on in order to open the doors and turn the lights on is the number of doses to come into the state so that we can begin administering. So the site itself remains on schedule and on track. As far as South County, we're looking at the Schneider Electric location in West Kingston.
Secondly, Dr. Nicole Alexander Scott, the New York Times had a somewhat alarming news story today about the coronavirus trends here related to the new variants. They write the U.S. makes headway against the virus, troubling trends related to it persist in the Northeast. Do you share that concern?
Absolutely. It's what we talked about today. It's what we've been discussing about the balance. The variant is here. It's been in the state, and it is more contagious than the other version. So we know it's going to spread more easily and continue to become more predominant. But it's exactly why we continue to focus on testing, treatment, vaccination, and why I spent the additional time today talking about wearing the best mask you have access to, using 2 layers if you have a cloth mask, and wearing it effectively. Those tools what we have leading the nation with testing, leading the nation with vaccination, and what we've shared today, making sure you get treated if you qualify, wearing your mask appropriately, will be what we need to get through this time period where we know the variant is continuing to spread.
Paul, go ahead. Governor, Dr. Jha has said now is not the time to be relaxing restrictions. Why is he wrong?
Oh, no, I don't think he is wrong. Dr. Jha is on our advisory group, and what he's saying is to make sure that we're following the protocols, make sure that we're making sure that we're staying safe. I mean, I had lunch with somebody who's supporting our local restaurants who had to leave the table because his dad was being rushed to the hospital because of COVID. As Dr. Alexander Scott said, this is why we need to be disciplined on this issue. So I think if you read and I actually was asked that question before I came here, exact question. And we read the articles, and I think you read the whole article, he'll show that what we're doing here with incremental flexibility and the way that we're gearing up for our capacity is exactly what he's been telling us in our advisory meetings. And we're following a lot of his direction because we look at him as a local expert. We're very fortunate to have Dr. Jha here in Brown University.
Dr. Scott and Tom McCarthy, what is being said on the stage does not match reality. Last Friday at 5 o'clock, it turned out just 1% of people available were able to get a vaccination. So this talk, or an appointment, excuse me. So talk about shot in the arms and this talk of top 5 and strong pace. Who's responsible for that website that was malfunctioning, going down? You had people taking time out of work. There was 2 hours of frustration. 1% of people qualified could get an appointment. Who's in charge of that? Why not hand it over to the private sector, CVS, Walgreens, and let them handle it when it's clear the state is not up to the task?
So the state is absolutely up to the task. What I described earlier is the fact that we had those few hours where we know a larger number of people who wanted the vaccine were attempting to log on. Once we have any vaccine available, we want to make it available so that it can get into the arms of individuals who were there. Yes, and we were not going to wait another week to make that available. It was important to make it available as soon as we had it, knowing, as I had said last week, that it would require patience, and knowing that we would continue to get additional supply. Even through the course of this week, we have learned of the additional supply that will continue to come, and we're continuing to work on improving the user experience with that. As we get the additional supply, we continue to make the adjustments to the technology. By April 19th, everyone 16 and older who want to get vaccinated will be able to get vaccinated, and we are in the top 5 nationally with getting first doses into people's arms. So we are equipped to doing it, and we'll continue to refine as we have done.
What about the phone system? Who's in charge of that? You can't even hold. I experienced it. People were telling me, I went on, they just tell you to call back later. Who's in charge of that? Are there 2 people handling the phone? Why doesn't it say, hold on? People have said they'll hold for 2 or 3 hours if they'll get an appointment. Who designed the phone system that just keeps telling you to call back later?
Yep, that is also part of what we are working on improving as we are adjusting to these numbers. It's a part of the entire system. There is a large number of individuals who are overseeing the phones and responding, and will continue to adjust in handling the number of cases as we need to.
Why not move a system like Massachusetts where you just register once and then the system lets you know when an appointment is available instead of having to go on every time appointments come up with a very minimal chance of actually getting an appointment?
Yeah, that's what was asked earlier. That is what we are developing, and we'll look to have that early on in April prior to expanding to all eligibility.
Just a waiting room, though, correct?
That's correct.
Director McCarthy, many of the events that are planned for the summer now, whether it's 1,000 people or 5,000 person events outdoors, there's some talk that they may require a vaccine certificate or something to be admitted. Are you confident that as these events are planning and spending money to make these events happen in the summer, that the system will allow for every person who wants a vaccine to be vaccinated by July 15th so that that person can be admitted to such an event, and that these events can go forth and the economics will work out.
Yes. Given the projections that we received yesterday from the federal government, I'm confident that by early this summer, anyone that wants a vaccine will have one in Rhode Island.
Thank you, everyone.
Including from the system's perspective, the back-end perspective, they're confident that the system to register for a vaccine will be corrected in sufficient time.
I am.
Come on.
Do you know the percentage of teachers that got a first dose?
I do. So very strong turnout among school staff, teachers, and child care workers. We've seen an 80% uptake so far that have been vaccinated or are scheduled to be vaccinated in the next 2 weeks.